All right, so let's jump right in. When we talk about the cutting edge of AI, our minds probably go straight to places like Silicon Valley, right? But what if I told you that one of the most critical testing grounds for AI's future in healthcare is actually unfolding right now in India? Yeah. Today, we're going to break down how India is leveraging AI to tackle a healthcare problem on a scale that's just massive, and more importantly, what it could mean for all of us. And this quote, it really gets right to the heart of it all. For India, using AI in healthcare isn't some fashionable tech trend. It's not about hype. It's about pure, unfiltered necessity. We're talking about a tool that's being used to solve fundamental structural problems that just can't be fixed the old way. And that idea? That's going to be our guide through this whole explainer. So, here's our game plan. First, we've got to understand the sheer scale of the problem we're talking about. Then, we'll look at how AI is being used on the front lines to try and fill those gaps. After that, we'll get into the tricky part, the double-edged sword of this tech. And finally, we'll zoom out and ask the big question, is what's happening in India a potential blueprint for the whole world? All right, let's get into it. Before we even whisper the word algorithm, you have to wrap your head around one thing: scale. India's healthcare challenge isn't just big, it's a problem of population. We're talking over 1.4 billion people, and a system that's stretched, well, to the breaking point. Okay, look at this number, 80%. That is a staggering figure. It represents the shortfall of specialists. We're talking surgeons, pediatricians, you name it, in the rural community health centers that are supposed to be the backbone of care. Just try to imagine that for a second. You or a loved one needs critical care, and there's an 80% chance the specialist you need just isn't there. It's a huge bottleneck, and it means people either have to travel for hours or, worse, just go without. And if that wasn't enough, the type of sickness is changing too. See, the healthcare system was originally set up to deal with infectious diseases. It's episodic, right? You get sick, you go to the doctor, you get a treatment, and you go home. But that's not the reality anymore. The biggest challenge today comes from chronic conditions, things like diabetes or heart disease that need continuous long-term management. The old model just wasn't built for that. So you start to see the problem, right? You can't just build more hospitals to fix this. I mean, training enough doctors and specialists takes decades, but the demand for care is going through the roof right now. And it's that gap, that ever-widening gap between supply and demand, where something like AI stops being a cool what if and becomes an absolute necessity. And that's where AI finally comes into the picture. Now, it's super important to understand this. The goal here isn't about replacing doctors. Not at all. It's about using AI as a force multiplier. Think of it like giving every doctor and nurse on the front lines a set of technological superpowers, letting them do more, see more, and reach more people than ever before. And this isn't just theory, it's happening on the ground. You've got companies like Quera AI, whose AI can analyze an X-ray in seconds and flag a potential case of TB for immediate review. Or Nearmai, using thermal imaging, super portable for breast cancer screenings way out in rural areas. And Tricog Health, that's a perfect example of that force multiplier. A health worker in a tiny village can perform an ECG. The AI analyzes it instantly, and if something's wrong, a cardiologist hundreds of miles away gets an alert. Game-changing stuff. And it's not just about diagnostics either. AI is being woven into the very fabric of the healthcare system. We're seeing it in precision medicine, like predicting which drugs will actually work against a resistant strain of TB. It's the engine behind the national telemedicine platform, e-Sanjeevani. It's even being used to sniff out suspicious insurance claims. I mean, it's touching pretty much every single piece of the puzzle. Okay, but here's where the story takes a turn. Because, as we know, technology is never, ever a simple magic bullet. And when you drop a tool as powerful as AI into a system that already has these massive inequalities, well, you have to be really careful. And this question gets right to the core of the challenge. Think of AI as an amplifier. It takes whatever system you put it in and just turns up the volume. So in a great system, it makes things even better. But what happens when you introduce it into a fragile, under-resourced environment? It can amplify the problems too. This is where that digital divide becomes so critical. I mean, imagine an AI tool built for a fancy city hospital with perfect, high-speed internet and pristine digital records. It'll probably work great. But take that exact same tool and drop it into a rural clinic where the power cuts out and the internet is spotty at best. It's not just that the tool will fail, it could actually make things worse, widening the healthcare gap between the city and the countryside.
And we're talking about some very specific, very serious risks here. For instance, data bias. If your AI was trained mostly on data from Western populations, can you really trust it to be accurate for people in India? Probably not. Then there's automation bias. An overworked doctor might start to over-rely on the algorithm, even when their gut tells them something's off. And let's not forget about AI hallucinations, where these models can just make stuff up. Plausible sounding, but completely false medical information. In healthcare, that's not just a bug, it's a disaster waiting to happen.
So, with all these risks on the table, how on earth do you move forward responsibly? Well, this is where we get to that potential blueprint. India isn't just diving in head first. They're trying to build a real framework to get all the good stuff from AI while trying to keep these dangers in check. And their approach seems to rest on three main pillars. Pillar 1 is all about data protection. A new law puts patient consent right at the center of everything. Pillar 2, regulation. AI tools used for diagnosis are now treated as software as a medical device. That means they have to be proven safe and effective, just like an MRI machine. And Pillar 3 is ethics. National guidelines are in place to make sure there's always human oversight and transparency, so a doctor is always in the loop. And holding all of this up is this massive, incredibly ambitious national project called the Ayushman Bharat Digital Mission, or ABDM. The idea is to create a unified digital health infrastructure, giving every single citizen a unique health ID. If, and it's a big if, but if they can pull this off, you're looking at the foundation for a national learning health system, a way to safely and ethically use data from millions of people to train even better AI tools for the future. So, as we start to pull this all together, what's the key lesson here, especially for other countries in the global south? It's this. Success isn't about having the fanciest, most complicated algorithm on the planet. Nope. Success is measured by how well your tech is designed for the messy, complicated reality on the ground. Can it work with a spotty internet connection? Is it simple enough for a completely overburdened nurse to use without a lot of training? Is it affordable? And crucially, was it trained on data that actually looks like the patients it's supposed to help? It's all about building for the real world, not for some perfect sterile lab. And that really leaves us with the final massive question. Will AI be the thing that finally helps us expand healthcare access for everyone? Or will it just end up making the very inequalities it was supposed to fix even worse? India is running one of the biggest, most important experiments with this technology on the planet right now. The stakes couldn't be higher, and you can bet the rest of the world is watching very, very closely.